program. And it's just a real delight to make the space to hear from our brilliant graduate students every year who are really out there doing a lot of the work for this project when it comes to the research side. I mean, under close supervision from some great professors and community partners and government partners, but really when push comes to shove, the success of this initiative rests on motivated students, curious students, talented students, and folks trying to make a difference with their research as well and their training. So it's just very important for us each year that we make some space to highlight their accomplishments, to highlight their work. Doing that this year and helping to do that this year is Ignacio Tiznado Aitken. He is, I should have said Dr. Tiznado Aitken. And Ignacio joined the Mobilizing Justice Project earlier this year as our research coordinator. So along with Jasmine Moazab, our project manager, Nacho and myself, and more Jamie Fisher, we kind of constitute the central team taking care of the day-to-day of making Mobilizing Justice work. And Nacho has, over the last few weeks, been wrangling our students to put together their research presentations for today's event. And I will turn it over to him to introduce the students, introduce how it's all going to work. And please do stay tuned. And we hope that you put your thinking hats on in the audience, because there's nothing the students want more than some tough questions from this diverse audience that we have here today. So be prepared. And yeah, with that, I'll turn it over to Ignacio, and enjoy the afternoon session, everybody.
Thank you for the intro, Steve. I will share my screen. So today's session, as you may know, is about students' presentations. Maybe some of you are not familiar with the concept of PechaKucha, but it's basically a storytelling format where usually presenters show like 20 slides every 20 seconds. Of course, for this session, we were not like very strict with the students, but the main idea is to have like a presentation that is easy to digest, using some images, diagrams, try to avoid like a lot of text, and basically have short presentations with their research. So for today, we have 5 different presentations. You can see the titles here. So we will have Joao, a PhD student in the Department of Geography and Planning at U of T, presenting about accessibility, perceptions, and self-rated health in the suburbs, particularly in the Scarborough. We will have Rosalie, master's student in the School of Planning at McGill University, presenting some work about lived experiences of transport poverty in a Montreal suburb. We'll have also Victoria presenting a really interesting proposal using a longitudinal study on aging, trying to understand transportation behavior and health outcomes. We will have Thiago as well, PhD student, also at McGill University, with a mixed method study, trying to understand a little bit the time and spatially different perceptions of people towards a new BRT infrastructure in Montreal. And finally, we will have Maria Laura presenting an index about transport-related social exclusion in Canada. So basically, the format for this year is pre-recorded presentations. So most of the presentations are like between 8 to 10 minutes. And then after each presentation, we'll have a space for questions from the audience, probably within like 6 to 7 minutes each. Okay, so I will start with the first presentation. Just give me 1 second. first presentation from Joao.
Hello, and welcome to the second annual Mobilizing Justice Symposium. My name is João Parga, second year PhD student in Human Geography at the University of Toronto and research assistant at the Mobilizing Justice Partnership and the Suburban Mobilities Cluster, SUMO. This PechaKucha will cover a research paper that I've been working on since last year with colleagues from SUMO and MJ. In it, we've investigated the statistical association between subjective measures of accessibility and health status in Scarborough. Self-rated health is one of the most used measures in academic research. It is a subjective measure of people's own perceived health status. Survey respondents rate their health on a scale that ranges from poor to excellent. And why does it matter? Well, multiple studies have shown that self-rated health is one of the best predictors of health and life outcomes, meaning that a person's response can be used to predict their their use of the healthcare services, its costs, mortality rates, and even social and economic disadvantage. And accessibility. In transportation planning, the focus has shifted from just moving cars efficiently to ensuring easy access to destinations. In other words, accessibility refers to how well people can access different opportunities using the transportation system. Despite the shift towards prioritizing accessibility, research in this area often relies solely on quantitative measures of accessibility, rather than considering people's perceptions. In essence, this practice overlooks people's subjective experience of accessibility. Within this context, we formulated our research questions. How are people's subjective accounts of accessibility and of their neighborhoods associated with self-rated health? And what about quantitative accessibility metrics? Do they matter as well? We examined these associations in Scarborough, a former municipality and now inner suburb of Toronto. As with other Canadian suburbs, the region is marked by automobile dependency. However, Scarborough also has a diverse population, making inequalities in perceived accessibility a pressing issue. Our primary data came from the Scarborough survey, which collected information on mobility challenges from multiple perspectives. The survey also collected respondents' postal codes, which allows us to estimate accessibility metrics, and their demographic data using self-rated health modeling. Based on current research and our available data, we developed our conceptual model that links transportation accessibility to self-rated health. In addition, we also consider known social determinants of self-rated health, which includes demographics, health, and quality of life outcomes. Our dependent variable, then, was the self-rated health from the respondents of the Scarborough survey. They range from poor, fair, good, very good, to excellent. We use overall health now, but we might expand in the future to consider physical and mental health. We focus on 4 independent variables. First, a quantitative accessibility metric called estimated accessibility that counted the number of healthcare facilities available within a 30-minute threshold from respondents' households. We used only land use and transport network data to estimate. Next, we created the binary variable to account for people's perceived accessibility to healthcare. We identified those individuals who reported having trouble reaching their primary doctor. Then, we created an affordability variable for transportation costs. Respondents were asked to rank the amenities they would like to have access to in their neighborhood. We use healthcare's position in this ranking to indicate their priority for healthcare access. Higher values indicated a higher priority, while lower ranks indicated a lower priority. We estimated 3 ordered logistic models. The first ruled out the estimated accessibility metric. In the second, we remove the perceived accessibility to healthcare. And the third contained all variables. So onto the results and descriptive statistics. These maps display the spatial distribution of healthcare facilities and survey respondents across Scarborough. We can see that there are pockets that concentrate healthcare facilities, but they seem to be fairly distributed. Survey respondents also appear to be randomly distributed across the region. On average, when compared to other groups, respondents who reported excellent health had the highest estimated accessibility. They also prioritized access to healthcare the least. In contrast, those who declared having poor or fair health status gave a higher priority for healthcare access. So, what did our model say? Estimated accessibility was statistically and positively associated with self-rated health. That means that those living in areas with higher access to healthcare facilities had a higher likelihood of having positive health status. Meanwhile, negative perceptions of accessibility were associated with worse health outcomes. Also, all else being equal, prioritizing healthcare access meant having a higher likelihood of reporting worse health outcomes. So, what do these results mean? If regions like Scarborough are marked by automobile dependency and subpar provision of public transit, then these unequal conditions of accessibility might lead to unfair health outcomes for some groups. The unjust distribution of health outcomes might be the consequence of unequal accessibility. Second, our study adds to recent work that has shown how subjective perceptions of accessibility should be considered in research. This is especially true considering how transportation planning has been dominated by the average traveler, without considering the capabilities and necessities of different groups. One of our main limitations is that we haven't investigated the causal relationships between the determinants of self-rated health. This is relevant for the ranking of access to healthcare facilities. It is unclear if prioritizing access to healthcare is a symptom or a cause of worse health outcomes. So, to recap, we've investigated the association between estimated and perceived accessibility and self-rated health in Scarborough. Our results suggested that perceptions of accessibility do matter. This means that people's accounts should be considered in accessibility research so that different groups can have their needs met. Finally, I would like to thank everyone involved in this research: Steve, Chris, Shaila, Ignacio, and Anton. My contact information is on the screen, so feel free to reach out in case of any questions. I look forward to the discussion in the symposium, and thank you very much for your time. Bye-bye.
Okay, so that was the first presentation from Joao, and now I wanted to open the floor for questions. You can say it out loud, maybe raising your hand, or just like put some questions in the chat and I can read it out loud. While we are like waiting for more questions or comments from the audience, I would like to ask you a question, Joao. And it's about like your results regarding socio-demographic characteristics. One of the things you mentioned in your conceptual framework is basically how individual factors can affect basically self-health rate. So I wanted to know if you have like any main results or interesting results, or which ones surprised you the most in terms of socio-demographic characteristics impacting self-rated health.
I'm not sure. Thank you for the question. Can you hear me? Is that okay?
Yeah.
Yes. So apart from the accessibility variables that I've mentioned in the presentation, all the variables that we found that were statistically significant in the demographic side behaved as expected, with exception to one. So individuals who are older, who reported having some type of disability according to the Washington set group of functioning. Those who didn't have any paid employment, and those who we estimated were classified as obese according to the body mass index. Those variables had a negative association with self-rated health, which is expected, right, given the literature. In contrast, higher life satisfaction was positively associated with self-rated health, which is expected as well, because self-rated health is very tight connected with well-being estimates. Sorry. The one variable that surprised us a little bit was recently moving to Scarborough. So this variable, so if individuals had moved between 2 years or less to Scarborough, they were expected to have a better self-rated health. This might connect to some research on immigrants' health that Bruce Newbold from University of Toronto, if I'm not mistaken, has conducted. And he has found that recent immigrants arrive in Canada, it is like expected that they have better health conditions than those who have moved in more than 10 years. And as the years go by, they tend to use the healthcare services more, and their health tend to decline. So one of the hypotheses Heath and co-authors formulated is that the screening, the screening tests for health conditions before you move to Canada might select some individuals who have a better condition before they arrived, and as they arrive, like they tend to decline their health conditions because of their use and like because of their immigrant status. So this is the only exception of the variables of the demographics that we can investigate later in the future, but it was not a very significant association in terms of statistics. So we'll see if that's significant. Oh, thank you, Shaila. Yes, Bruce Newbold is from McMaster. Thank you very much.
That was a good correction. Thank you, Shaila. I'm reading another question from Liza. What considerations went into defining perceived accessibility as a binary variable?
So thank you again, Charlie, for the correction. And Elisa, this variable was created based in one of the questions from the survey. And like the question asked, if I'm going to read it like, how much trouble is it for you to get transportation to your primary doctor? Or if you don't have a primary doctor, your walk-in clinic, or you use or you are closest to. So respondents had 4 options to respond. So the first one was no trouble, and then it went from a little, some, and a lot of trouble. So we classified those who responded having no trouble as no, and the rest as yes, and we created the binary variable. And in terms of like descriptive statistics, as I think I don't know if I mentioned in the presentation, but as the proportion of individuals that reporting having trouble reaching the primary doctor, or in other words, like who had a negative perceptions of accessibility to healthcare, this proportion decreased as the self-rated health improved, which means that, for example, people who report having poor or fair health status had the highest
priority to the chat. So
Please
I have
do.
one from Karina. What is the one thing you hope practitioners can do with your research?
So one thing that is, at least in my experience coming from another field of work, but coming to the transportation geography field and dealing with accessibility, is that there's the field has been dominated by quantitative metrics of accessibility, even though the own field has acknowledged that perceptions matter. And recently, some recent work has started to put the perceptions component into the table, right? So one thing that would be useful for practitioners and more so maybe researchers is to try to include perceptions in the estimations of accessibility. So instead of just relying on land use data and transport network data to create like a quantitative measure of accessibility that disregards people's perceptions, one thing that we should be mindful of is that different groups have different needs, right? So how can I say, people who are older, for example, have a different perception of their accessibility when compared to younger groups, right? Men and women have different walkability, which is known in the literature as well. So I think one thing that we can take from the research is that, one, that perceptions matter, and the second one is that if different groups have different needs and these different needs are not considered, so maybe the most vulnerable groups are not being taken into account when transportation planning is doing estimates that will influence public policy. So I think that's one of the main takeaways. I hope it answered your question.
Maybe if you can answer very shortly, like the last question from Colleen. Did the survey allow for uncontrollable non-health factors such as snow clearing, which might vary outcomes to access the doctor?
Yes, Colleen, thank you very much for your question. And I very much relate to that coming from Brazil originally. The winter is very different, the conditions, than in other seasons. But unfortunately, our survey did not control for that. So this might be, I don't know if there will be other rounds of the survey, but this would definitely would be a good variable to include, right? People's perceptions of how the weather affects their accessibility and their perceptions of accessibility as well. But unfortunately, it was not controlled in the first survey.
Perfect. Thank you, Joao. And thank you for the questions as well. Really interesting. So we will move to the next presentation from Rosalie. I will share my screen.
Hi, my name is Rosalie, and today I'll be presenting my honors thesis that was called Lived Experiences of Transport Poverty in a Montreal Suburb, a case study of Saint-Jean-sur-Richelieu. So I completed this research as part of my honors thesis last year in my undergraduate degree in urban studies at McGill University, and it was supervised by Professor Kevin Menard. And now I'm currently a Master's of Urban Planning student also at McGill. So to start, I'll just go over what transport poverty is. So transport poverty is very complex and includes a number of different aspects. But to give a very brief definition, we can define it as the compounded lack of ability to travel to important destinations and activities. So transport poverty occurs in the combination of transport disadvantage and social disadvantage. So transport disadvantage could include things such as not being able to have a car, the high cost of transportation modes, and having access to poor transit. And social disadvantage could include elements such as having a low income, not having a job, having ill health, or poor housing. And when these two are in combination, then that leaves people vulnerable to transport poverty. Specifically in my project, I decided to look at suburban transport poverty. I decided to do this because suburbs are seeing more and more poverty, like poverty is suburbanizing. So that would be like a social dimension of it. And also suburbs are often very car-dominated areas, which sometimes have more public transit opportunities. So that would create a transport disadvantage, meaning that suburbs now are becoming increasingly vulnerable to transport poverty. So to examine these phenomena, I decided to lay out 3 research questions to look at in my case study. The first one being, what are the consequences of living in transport poverty on people's daily lives? The second one being, what are the travel behaviors, if any, used to cope with transport poverty? And lastly, how does it affect social inclusion and well-being? So Saint-Jean-sur-Richelieu is actually my hometown. It is located on the south shore of Montreal, about 40 kilometers from the downtown area. It is quite a large suburb. It has around 100,000 people living in it, and it's the 11th largest city in Quebec. As you can see by the mode split, according to the 2016 census, about 85% of people drive to work. So this is a very car-dominant type of environment with most people driving, which creates an issue for people who are not able to access cars, for example, and they have to rely on other modes of transportation. So I also wanted to take a more qualitative analysis to transport poverty in the suburbs, because I really wanted to delve deeper into lived experiences and how people were dealing with these challenges. So to do that, I conducted semi-structured interviews. I recruited through Facebook ads in community groups and through snowball sampling, which gave me a sample of 9 people, which included a significant number of students, about 5. Of those 9 people, 4 completed a travel diary prior to the interviews, meaning that they took note of all of their travels for a typical day in their lives, and then we discussed them into the interview. And I took both of these and analyzed them thematically to lay out some large themes and some sub-themes to better understand transport poverty in this case study. So I organized my findings as follows. I firstly wanted to really understand what are the difficulties, what are the transport challenges that are present in the case study, to better understand then how this would impact the lives through the consequences of transport poverty, as well as how they were dealing with it with the travel behaviors used to cope with it. And then lastly, how it impacted their social exclusion and well-being. So these were kind of my 3 research questions that were laid out. So firstly, for transport difficulties, as you can see with some of the quotes that I pulled here, of course, these are all pseudonyms, but there are very significant challenges in Saint-Jean-sur-Richelieu. For example, Martine is an unemployed woman of 46-year-old, and she says that her combined cost of travel, including her car and taxis, for example, amounted to more than her mortgage. So it was a very significant impact on her life. As well as Antoine, who had difficulties getting to work because he worked at the hospital, and it was a 15-minute drive by car, but it would take him 45 minutes by transit. So these are some examples of some common difficulties laid out here. So again, affordability is through cars, but also the cost of transit, which is quite high in my case study, and then taxes as well. Scheduling was also a very important issue, especially on the weekends or later in the evenings when people were trying to get around, but there were no buses running. The bus route also presented some accessibility challenges where some people cannot reach certain destinations or certain neighborhoods at all. And of course, long travel time, some people were spending excessive amounts of time in public transit, this was especially the case for students and people commuting outside of the suburb. And then for consequences, these were also very significant. For example, the new 38-year-old warehouse worker, the cost of transit was very significant for him. So if he didn't look at his budget or plan accordingly, it would happen that some days he could not afford the bus to go to work, so he could simply not go to work. And then Martin also was not able to access agricultural transportation. So some days she would be out of bread or essential and just simply not be able to go to the shops and get what she needed. So these are some examples of foregone trips and missed opportunities. So people were not being able to go see friends and families or go buy the things that they needed, as well as reduced spending because of the high costs. People would cut through groceries or other activities. And of course, lost time because they're spending a lot of time in the bus. So when they get home, they don't have time to cook or to rest or spend time with family. And a lot of people were about to get a car, even though they couldn't really afford it, to try to avoid the issues that they encountered with public transit. So they were about to enter forced car ownership. And then a lot of people explained to me that they had to resort to other travel modes to cope with transport poverty. For example, having to bike around because they couldn't afford the bus, or other strategies that were used were planning ahead. So trying to prioritize doing activities on the weekdays versus the weekends because the transit schedule was better. So these are examples of planning ahead, cycling and walking. Sometimes it was necessary because the bus did not reach those destinations. And then we have trip training, which some people would group certain trips together to reduce the overall number of trips that they would take. When transit was not available or other modes were not available, people would have to ask for lists from family and friends to come get them. Or when all those were not available, the last resort is mainly taxis because they're very expensive. So they would try to avoid those, but sometimes they were unavoidable due to scheduling, for example. And then the last part of my research really looked at social exclusion and well-being, how it impacted them. I found that particularly students were really impacted in their well-being. For example, Antoine had a really hard time with being tired all the time because we had to wake up early in the morning to take a bus. And they were also very stressed because of the bus being late and having to miss school. So this is one of the reasons why he actually dropped out of school. Then we also have Amanda, who said she had difficulties making relationships with people, especially people who live outside of the suburb. So these would be examples of this would be an example of reduced access to social networks because it impacts the relationships and it's difficult to see loved ones as much as you want to. And stress and fatigue was also very important, especially for students. People who worked sometimes were able to try to me that they were able to relax on the bus, but for students, this was a really large impact of transport poverty. So in conclusion, I found that in my case study of Saint-Jean-sur-Richelieu, again, there were very important challenges to transportation among my participants, and this impacted their lives in a very direct way through daily activities, but also had some deeper impacts on the well-being and social exclusion. For future research, this study was obviously had a smaller sample size, so it could be expanded upon compared to other suburbs, as well as I think exploring transport poverty among students could also be an interesting aspect, as many of my participants were students and they really struggled with well-being, like stress and fatigue. So this could also be an area that could be expanded upon. But in general, this was the transport poverty was a significant challenge in Saint-Jean-sur-Richelieu that could be addressed through, for example, providing more adequate public transit that is also at a lower cost, which could help many people get out of transport poverty. Thank you.
Okay, thank you, Rosalie, for that presentation. And now again, we have space for questions, maybe 5 to 6 minutes. So you can say it out loud or just put a comment on the chat. Well, we have Dominic here. So, Dominic? I think you're muted, Dominic. Maybe in the meantime, we can hear from Stephen.
Sorry, Dominique, maybe try again. I just,
Yeah.
Okay, perfect.
Yeah, it's working now.
Okay, amazing.
Yes, perfect.
You want to go ahead first?
Sure. It was a quick question, actually. Thank you for the presentation, Rosalie. It was quite interesting. And I'm also working on social exclusion in Quebec related to transport. So I've never seen work done on Saint-Jean-sur-Richelieu. So that was quite interesting. I'd like to know maybe a little bit more about your methodology for analyzing the qualitative semi-directed interviews that you've done. If you just can tell us a bit more about that.
Yeah, of course. So I had my interview transcripts, and from then I like started to develop overall themes and codes. A lot of it was kind of based on the previous literature review that I had done as part of my thesis. So that's kind of where I pulled some of the themes. Some of them also were like just very obvious, like from the interviews themselves, like talking to the people, they were very recurring. And through a lot of them, so that's how I did it. I used like Atlas TI to do some of the coding, some of the software, and then from that I mostly just like based it on the quotes that I had highlighted and what kind of trying to make sense in meaning out of those. And that's the main way I analyze the data.
Okay, perfect. Thank you, Dominic. Stephen, yeah.
Yeah, I was hopefully you can hear me. Sorry, I have to get into traffic to get to where I'm going, but I just did pull over to do this. You know, one of the things we discovered when we're interviewing people about trellis transit, trellis is the elevated microrail system, so there's no congestion. There's really two fundamental groups of people. If you start talking to someone and they're going to lose their job if the GO train is late or if they don't make it to the hospital, you know, if it's a nurse that has to be there at 7 a.m. every morning, they have a type of stress that the other folks, and typically if you're dealing with executives, you know, they'll say, oh, you know, if the GO train's delayed, I don't lose my job. I don't feel any stress from transit delays. And if you started discussing that way, and I was going to ask, you know, whether in the comments that different you know, interviews, whether you categorize people to the people who have to be at a job on time and those who have enough executive privilege or whatever you want to call it, that, you know, if transit's delayed, everyone goes, oh, fine, he's just delayed because of, or he or she's just delayed because of transit.
Yeah, for sure. I think that's a really good point. I think most of like I had around like 4 students in my sample, so it was quite like a large proportion. So I think for them that was like a really like some students were like, oh, some profs are really hard on like deadlines. Then they close the doors and I can't go to my class, so I have to leave like an hour early just like in case something happens. So like that kind of is similar to your point, but I definitely think that that's definitely something that you can like compare and also like analyze from like a certain view of like privilege of like what kinds of jobs people have, what opportunities do they have, and what do they not have. So thank you for that. It's a really good point.
Yeah, like even if somebody's handing in an assignment, they have to get there, you know, the last time to hand it in is at 5 or 4. They have that stress. And I noticed you get totally different answers from people in transit if they don't have any stress, they don't have any deadlines, they're just free and easy. They go, oh yeah, when it's delayed, I just pull out my iPhone or read a book or whatever, versus other people who have to rely on it. So yeah, that's really good. Great presentation. Thanks.
Thanks so much.
Okay, we have one more question in the chat from Karina. What is the one thing you hope practitioners can do with your research?
Yeah, that's a good question. I think one thing that kind of inspired me to do this research is just that like from like living in the environment that I kind of studied, it's like public transportation is not really something that people really talk about like on a daily basis. Like most people like drive, but I found that the conversations were like not really it was not something that was really talked about. So I really hope that like by bringing these like stories and experiences like to light with this research, that like practitioners are really like just aware of the impact that it has on people and what is the impact they can have, like how the importance of the changes that they could have. Like one example is like the transit is like very, very expensive in Saint-Jean. Like it's like taking a bus now, it's like $4.50. And that just has a really big impact on like everyone that I interviewed. So just like things like that to just like keep in mind that do these like qualitative type of analysis, that this just really has like it actually impacts like personal people's lives a lot. Yeah, thank you.
Yeah, thank you for the questions. I really encourage you to read some of the compliments from Megan and Colin about your work, like the really great work you did in your thesis, explaining concepts like in a very clear way, simple way. So yeah, very, very nice comments about your presentation. Thank you so much. We'll move to the next one just for the schedule. So Next one is Victoria.
Hi everyone, I'm Victoria Ramirez and I'm a master's student at McGill University, working in the transportation modes group with Mobilizing Justice. Today, I'll be sharing a bit about my research topic and my thesis. As many know, the aging population in Canada is growing. As we speak, the number of those over 75 is doubling. In fact, over 861,000 people aged 85 and older were counted in the 2021 census, which is more than twice the number observed in the 2001 census. And over the next 25 years, the population aged 85 and older could triple to almost 2.5 million people. As more Canadians are living to 85 and beyond, an increasing number of individuals will face limitations and long-term health challenges. This puts an increasing pressure on all levels of government as resources are needed to ensure adequate support in areas such as housing, transportation, healthcare, and home care, among other things. With the growing population and demand for resources, the UN has declared this decade as the decade of healthy aging. Healthy aging has been defined by the World Health Organization as a continuous process of optimizing opportunities to maintain and improve physical and mental health, independence, and quality of life throughout the life course. This decade of healthy aging focuses on changing how we think, how we feel, and how we act towards aging, cultivating age-friendly environments, and creating responsive healthcare systems and services. Ultimately, the decade of healthy aging is dedicated to improving the lives of older people, their families, and the communities in which they live. Healthy aging and well-being are a result of intrinsic and extrinsic factors, or individual and environmental factors throughout the life course. Therefore, healthy aging is determined not only by our genes and our personal characteristics, but also by the physical and social environments in which we live our lives. Environmental factors such as suitable housing, social facilities, and transportation have a large impact on well-being and can foster feelings of independence, social connection, and positive outlooks on life. To create age-friendly environments, we really must address those social determinants of healthy aging and enable all people, irrespective of their level of physical or mental capacity, to continue to do the things that they love and value and live dignified lives. As we know, transportation has a profound role in this challenge and healthy aging. In other words, accessibility and transportation are key pathways to healthy aging. In fact, Glasner et al.'s conceptual framework links urban and transportation planning to public health. There are a few levels to the pathways. On the first level, we see urban planning and transportation policy, including land use in the built environment, transportation infrastructure, transportation mode choice, and technologies and disruptors. On the second level, we see different pathways to health via transportation exposures or lifestyles, some being beneficial to health, such as increased exposure to green spaces and aesthetics, increased physical activity, increased access to health promoting opportunities like healthcare and services, and mobility independence, or the concept of meeting your needs on your own, which has both cognitive and physical benefits. Then we see others being detrimental to health, such as air, noise pollution, social exclusion, community severance, and more. For my research, I'll work with this conceptual framework to draw relationships between transportation and healthy aging for older Canadians. So I'll explore how land use in the built environment, transportation infrastructure, and transportation mode choice impact the determinants of healthy aging, including social exclusion, mobility independence, access, physical activity, and more. To conduct my research, I will use the Canadian Longitudinal Study on Aging, or the CLSA, which is a large national long-term study and research platform of more than 50,000 individuals who are the ages of 45 and 85 at recruitment. Essentially, it's a survey that covers many areas, including physical and psychological health and well-being, lifestyle and behavior, loneliness, social isolation, social engagement, transportation and mobility, gender identity, income, and other socio-demographic elements. The fundamental goal of the CLSA is to provide a research platform and mobilize experts in the community to generate scientific content enabling interdisciplinary population-based research and evidence-based decision-making, leading to better health and quality of life for all Canadians. So in using the CLSA, my thesis aims to broadly answer the questions: what is the relationship between travel behavior and healthy aging in older Canadians? And how does the relationship between travel behavior and healthy aging of older Canadians vary by socio-demographic and socio-economic factors while controlling for the built environment and transportation accessibility? As an applied aging population health and transportation researcher, I want to contribute updated empirical evidence that shows the relationship between healthy aging and transportation opportunities and barriers, so that we can really bring better solutions that empower Canadians to age healthily while enabling older Canadians with feasible transportation. Thank you, and stay tuned.
Okay. Thank you, Victoria, for the presentation. We have some space for questions again. Well, I can start with a question. I'm very curious about like the data set that you will be using. So I don't know if you can tell us a little bit more about like the data set, basically what are the years that you have available. If you have any information about like how good is a representation like between these different social demographic groups or health status or transportation modes. Any information about like the spatial disaggregation, like anything that you can tell us about the data set that seems to be really, really interesting.
Yeah, definitely. Thank you for that. So like I said, I'll be using the CLSA. And the years right now available are from about 2010 to 2021. So the baseline was around 2010, and then there were two follow-up waves. One between the years of 2015 and 2018, and then a second wave between the years of 2018 and 2021. So really they're following participants every 3 years, and that they're getting information based on that. As far as representation goes of, for example, socio-demographics, health status, and transportation modes, I would say the representation is pretty good. Socio-demographics, you have basic information as far as marital status, income, retirement as well. And then one I'm really excited about is the inclusion of gender identity. So they're including sex, but also gender identity. Yeah, as far as health status, it's really quite thorough. There are 2 surveys. One is self-reported basis, and then the other one is more clinical information. So it's covering physical and cognitive health, but you get both aspects of self-reported health and actual clinical information. But both are looking at chronic conditions, diseases, and other health-related aspects. Personally, for my research, I'll likely stick with the self-reported side, primarily regarding healthy aging, maybe some unmet healthcare needs, and looking at mental health as well, and areas related with that health. So looking at aspects like loneliness, social participation and social support, quality of life, and life satisfaction. And then as far as transportation, it covers a lot. I would say a lot more than most health surveys do, but covers driving status and driving cessation, collisions, mode choice, trip purpose. And then it also, one part that I'm excited about is barriers in transportation as well. So it's explicitly asked about, why didn't you take public transportation, or why have you not been utilizing accessible transit? And it gives a lot of different options as to what those barriers may look like for the aging population. So I'll definitely tap into that. And yeah, as far as the spatial component, so it's the FSA. So that's what I'll be using as far as the spatial analysis.
Okay, perfect. I'm reading a comment from Colleen in the chat. Appreciate Victoria highlighting the connection between built environment, designs of neighborhoods, and universal design to facilitate health aging. For instance, the loss of perceived identity and freedom due to mandatory driving tests at age 80, and experience a lack of freedom and social status, no longer being able to drive, that make taking transit as first choice for all ages. I don't know if you want to like add something, Victoria, on that comment.
Yeah, I mean, I think that's really important. And I would personally love to see a shift between from driving first to public transit first, and having that be a realistic and accessible option for the aging population. I know there have been initiatives to do that, free transit for aging population. But I think really that shift would be really valuable for the population, and valuable for the people that are caring for that population as well. So not only improving their lives, but the lives of people around them. So I think it's really important.
Great. Maybe we have space for like one last short question from the audience. Dominic?
Yeah, my question is also about the data set. Thanks for the answer, Victoria. It's quite interesting. I was wondering if you were talking about the transportation mode availability or accessibility. And one thing I know in rural Quebec, there's a lot of volunteer-based transportation. It's organized by volunteer association, especially for medical transportation, for people who don't have the driver license, where there is very little public transit service. Do you know if that is included in the data that you have, the availability of these kinds of service and the barriers to using them?
Yeah, that's a really great question. As far as the barriers that it captures, it does cover things like cost. It covers things like availability of it, timing of it. I don't know that it goes into specifics about the programs available and opportunities in that, but it definitely does cover what barriers people may experience with accessible transit or volunteer-based transit in general. But I think it'd be harder to capture, more rural areas because it is transnational. So you're looking at every province in it. But it does cover a lot of barriers that the population may experience within accessing that type of transit.
Okay, thank you, Victoria, and good luck with the next steps of your research. We'll move to the next presentation from Thiago.
Good afternoon. My name is Joao Carvalho. I'm a second-year PhD student at the School of Urban Planning at McGill University, and today I'm going to be presenting on the first paper of my PhD work titled Changes in Perception Over Time and Spatially Towards a New Bus Rapid Transit Infrastructure in Montreal, Canada. So first, I would like to thank and acknowledge the funding agencies involved with this research. First, the Mobilizing Justice Initiative and CERC, and also the co-authors of this paper, Professor Ahmed Bnadi, Stephen Farber, and also Matthew Paul, for their contributions to this work. So we already know from the literature that new BRT infrastructures, they lead to changes in travel times, they lead to changes in service reliability, they lead to changes in travel preferences and behaviors. However, we still do not know how perceptions towards these new infrastructures change over time in terms of how acceptable this infrastructure is, both to people living in the region and for people living within that city. So our main question for this paper was, how do perceptions of a new BRT line change between before and after its opening? And more specifically, we were also interested in understanding the differences in perception between those living close to infrastructure and those living farther from infrastructure. And this, in the case of this specific BRT line, we also had an extra layer of analysis because those living close to infrastructure tended to be low income when compared to the rest of the island to the rest of the Montreal Island. To answer these questions, we use a mixed methods research design, and we had both quantitative and qualitative data. So for the quantitative data, we had attitudinal statements in which we were looking at the changes in response patterns over time. And within the thematic analysis, we had open-ended response questions. We had open-ended responses in which we were looking at the changes in the frequency of the themes from before to after the opening of the line. So our case study is the Peanut BRT corridor, which is a line that opened in November of 2022 in the east side of the Montreal Island. So in red, you see where the line is going through. And it spans over 13 kilometers with 14 operational stations. And it connects several commuter routes from the metropolitan region and to the island. As I said before, the corridor, the buffer in gray, it has a high percentage of low-income residents, and it has people living in that region show 33% lower average annual incomes when compared to the rest of the island. So we use data mostly from the Montreal Mobility Survey, which is a 4-wave survey conducted by the Transportation Research at McGill, which I'm a part of. And it collects data on perceptions towards infrastructures here in the island and also travel behavior patterns. So I used mostly data from wave 2 and wave 3 because wave 2 was collected in 2021, which was before the opening of the line, and wave 3 collected in the end of 2022, right after the opening of the line. So in terms of the attitudinal statements, we had over 2,300 responses for both points of time. And for the open-ended comments, we had 200 in 2021 and 251 in 2022. So first, looking at the changes in the attitudinal statements, we start with first with people living close to infrastructure, and we see no change in the project being good for Montreal. However, people became less positive about it being good for the neighborhood and more neutral towards it. On the other hand, people became less concerned about the gentrification processes as the project was being developed. In terms of outside the buffer, we see less change when compared to people living close to infrastructure. We see no change in it being good for Montreal. We see people becoming more positive about it being good for the neighborhood. And we see no changes in concerns about gentrification processes. When we go into the thematic analysis, we see that people tend to be more negative and just express their concerns, as it's already known from the literature. However, we see clear differences in the patterns of responses from people living within the buffer and people living outside the buffer. So people living within the 1 kilometer buffer that we established around the line, they tend to be more concerned about the everyday impacts of the line, such as the nuisance of construction, the expansion of the BRT line to other underserved areas on the region, and also about road safety. Since there was a previous BRT line back in the 2000s, which has been closed due to a series of crashes with pedestrians and cars that happened at the time. People also, over time, after the opening of the line, they started expressing discontentment with the BRT services, both in terms of frequency of service, travel time, and also the design of the stations. Outside the buffer, people focus more on the citywide impacts, such as the financial aspects, meaning how much the project costed, and also the efficiency and the execution, meaning how long it took to complete the project. So to conclude, within this paper, we provide evidence and perceptions towards the new BRT infrastructure change both over time and spatially. And that results for qualitative data, as shown in the literature, they present a more skewed view of the self-acceptability of the project. So we also see that different policy directions are needed depending on where people live. So at the citywide level, there's a need for better communication of the benefits and challenges of implementing new BRT infrastructures. And at the regional level, besides that, we also need service. We know ways in which service could be improved given its feasibility. So both in terms of improving service through frequency, sheltering, service in stations, and also communication around how much the project is going to influence and impact the region in terms of construction. So that's what I have today. I thank you for your attention, and I'm open now to questions and for your questions and your comments regarding this research project.
Okay, thank you, Thiago, for that presentation. Again, space for questions. Some reactions from the audience. Any questions? You can put it in the chat as well. So in the meantime, I have a question for you, Thiago. Really interesting presentation. This is maybe more like a technical question regarding like setting the buffer in 1 kilometer. I don't know, like if you maybe tested like, I don't know, other type of buffer, basically, I don't know, 500 meters or a difference if you consider like people living within like 2 kilometers instead of just 1. So yeah, basically like what was like the rationale behind selecting just like 1 kilometer around the BRT?
Thank you for your question. So most of the rationale was based on 2 things. First, we had previous research here in Montreal showing that that's like the maximum amount that people are willing to walk to high service frequency routes, like the metro and the train. So that's some research that was conducted previously by Trent, by the research group that I'm at, and we base ourselves on that. And a second point was more regarding the data itself, because the Montreal Mobility Survey, which is the survey that we used for this specific project, is mostly concerned with the REN and not with the PNF-BRT. So that means that we had less people living within the region. So if we try to limit too much the buffer, we would not have a big enough sample size to conduct the analysis in which we would have like statistical significance. So also given that the changes in the region in terms of the PNF-BRT, they're going to bring changes in the land use development. So having a little bit of a bigger buffer would also allow us to see how people who are just a little bit farther from the PNF-BRT, how they feel that they are going to be impacted as well.
Okay, perfect, thank you. We have 3 more questions in the chat. So first, Michael, how much do you think these findings might generalize to other projects or contexts?
That's a very good question, especially because it's a BRT in North America, which is not the type of project that we see people tending to lean towards. And that's something that we also saw among the comments of the respondents. People really wanted the project to be a tren or an LRT. I feel that people feel more safe in the infrastructure itself. It's not bus-based. So I feel that this project and these results, they really apply to North America and not specifically to the global South, where people tend to have more acceptability of BRT projects.
Okay, Jeffrey also said, what was the most surprising thing you observed in your research? Something that came up your attention, maybe?
Yeah, for me, I come from a city in Brazil where it's very heavily based on BRT services. I come from Curitiba, which is quite well known within the transportation world. So seeing so much negativity around BRT projects in Montreal, that for me was quite surprising. And seeing how much people really disliked that the project was a BRT and not an LRT, that for me was kind of heartbreaking in a lot of ways. And understanding the mentality of people here, that's something that I'm going towards, and understanding these changes in perception. So for me, the negativity was a big thing for me.
Yeah, absolutely. The context in the Latin American context is completely different in some ways. And the last one is from Colleen, just like appreciating the work, the policy approaches. So do you have an example of the policy and communications to address perceptions? For instance, Calgary has moved to high frequency transit, yet people in the suburbs now walk 20 minutes and go through 26 traffic circles within like 2-hour commute each way. So the equivalent of traveling time to go to Calgary to Edmonton. I don't know if you have any thoughts on that.
Yeah, well, to address perceptions is mostly related to what we call as soft policies. And those are policies that they're not trying to change behavior itself, but they are just trying to address perceptions. So we see a lot of work from a couple of researchers like Fiji and in which they do studies, or they did studies back in the early 2000s, where they would offer people free fare, so they would experience the service around then, or it's mostly about making people experience the service or change their behaviors very slightly, so that they can perceive service in a different way.
Thank you, Thiago, for your presentation and your great answers. So I will move to the last presentation from Maria Laura.
Welcome, everybody. Today I'm going to tell you about the process of fitting a transport-related social exclusion index for Canada. It is very important to mention some basic concepts that we will be referring to during the talk. First, social exclusion. which is what happens when an individual does not participate to a reasonable degree over time in certain activities of their society for reasons beyond their control, and that they would like to participate. It is worth mentioning that it is a complex concept of multidimensional nature. We also have transport disadvantage, which is the lack of transport-related resources that hinders an individual's potential mobility. This lack of resources can be of different nature, for example, due to physical or mental impairment, old age, lack of resources to afford fuel or transport tickets, or unsafe conditions to make the trip. In that light, the interaction of any or many classes of social disadvantage and any of the forms of transport disadvantage produces transport poverty, which implies a lack of access to resources and services, which turns into transport-related social exclusion. In time, this exclusion or lack of participation in society leads to more social and economic disadvantage in circular pattern. What is important here then is to understand transport as a tool of potential to overcome disadvantage, of the potential for reaching new jobs, new schools, for alleviating health constraints, for reaching stores, friends, family, support, anything we may need. The objective of this work was to create a decision-making aid for researchers and practitioners, which had to be available for the whole country, easily updatable, and easy to communicate. Using census data, we worked with a group of weighted sums. On the one hand, for socioeconomic disadvantage that combines different categories in the spectrum of social vulnerability, all with equal weights. On the other hand, we measured the transport disadvantage with accessibility to different types of destinations by different modes, giving the most weight to work, then to groceries, followed by both basic and post-secondary education, then health, and then art and cultural recreation facilities with same weight. When we combine them, we have a continuous index with half of each of these types of disadvantage and another categorical index based on a classification of the combination of deciles of the two types of disadvantage. The continuous index looks like this. The darker the color, the more transport poverty. And we started facing the conceptual challenge of having a single index in so many contexts. If we think of the audience that will use this tool, they are practitioners, which means that if you are a planner at the provincial or regional levels, this will not tell you where you need a new bus line. Why would you compare what happens near Toronto and a rural area in Saskatchewan when they have different conditions and different needs? To solve this, we normalized according to census metropolitan areas or agglomerations to produce a more local scale. But CMAs and CIs don't cover the whole national territory, and they are still a bit big. So our third measure was the census division. It's not an administrative area, but it is useful for the immediate context and can be aggregated or sliced up to administrative boundaries. And what it brings is a much more local perspective. With these three scales, we hope to have covered some of the problems of scale and sparse context. If you remember, in the methodology, we classified transport-related social exclusion into these categories based on the combination of deciles of both components of the index. Because continuous measures are relatively abstract, they are useful for research, but practitioners, decision makers, investors, and public communications in general can use a categorical classification that holds a concept they are interested in attached to it. This is the visual result of the risk classification. For the results in a national scale, we can see that 1.2 million people are at the highest risk, 1.9 at very high, and 3.6 million people at high risk. That is 18% of the population in the higher categories of risk. It is surely less than in other countries, but still, it means that 6.7 million people are at risk of transport-related social exclusion in Canada. A snapshot of the national map looks like this, where the cities are at lower risk and the high risk is pushed to very rural or remote areas. When we analyze the results of the CMA and CA's rescaling, we see that Toronto has around 25% of their population at high risk, followed by Montreal and Vancouver with around 15%, then Calgary, Edmonton, and Ottawa between 5 and 10, and then all other cities with less than 5%. However, when we rescale each city's high risk to 1, we see that the proportion is very similar between them. All of them have around 60% of the population in the highest and very high risk categories. And in fact, Calgary and Hamilton have more population at risk, at high and very high risk than the bigger cities. The map shows almost all centers at low risk and rural areas at high risk, but it still seems to blur the real conditions for city planners. When we rescale by census division, we see an increase in the population at risk, but the gap of percentage of population at risk between Toronto and the other cities becomes bigger. And the localization of the territory changes and becomes more informative of the real situation. It becomes useful for practitioners to show the areas where interventions are needed that need to be connected by transport to escape social exclusion. These are of actual use for local practitioners. And the following logic steps for this work are the validation of the index, stages of improvement and refinement, for example, testing other weights or including other modes, and socializations to practitioners in both the public and private sector. Thank you very much.
Okay. That was Maria Laura's presentation. I'm not sure if she's here to answer questions. She was trying to make her best to be here today, but I'm not sure if she's here. So if you have like any specific questions or comments about it, I will make sure to send them those questions. Maybe we can answer like after the session. And yeah, basically, I just wanted to take this final minutes, first of all, to thank all the students for doing these presentations. For us as a partnership, it's like essential to have them participating in the project, creating contributions. You can see how many good comments in the chat, interesting questions. Basically, they are like essential part of what we are doing and our goals. So first thing is just to thank them for being able to present today and to be able to answer different questions. Also to the audience for great comments, great questions for the students. And just give me 1 minute before you leave, because I want to make some sort of promotion for our next day of the symposium. So as you may know, this is just the first day of our second annual symposium. We are planning to have a second day. It's in October 12th. Probably Jasmine will share on the chat the link for registration if you haven't registered yet. But basically in that day, we'll have presentations about measuring transportation equity. We'll have presentations about cycling and race, indigenous mobility justice. We'll have also a really interesting work about views and values of transportation equity from elected officials. We'll have plenty of updates from the different mobilizing justice pilots. We have some working on bike sharing, e-bikes, older adults and transit, and also more incoming pilots for the next years. We will have a session also showing our accessibility dashboard. That is a platform that we created with ESRI Canada for transportation equity and accessibility analysis. And finally, we'll have a keynote presentation from Dr. Mimi Scheller, that she has been doing like an amazing contributions on the mobility justice topic. And she will be talking about mobilizing and ethics of care for mobilizing justice. So We really encourage you to register to be in this next session of our annual symposium. And finally, I know that Steve and Jasmine were like sharing during this session in the chat link for an exit survey. We really want to have like some sort of feedback from you, the experience at the symposium in this first session, any feedback that you want to share with us. This is really helpful for next week, but also for the next annual symposium that we'll do in our year 3 and 4 for the project. So you know that you are part of our community, so your feedback is really important for us to improve and to create a space for everyone to share your experiences and also your expertise. I'm not looking at the chat. I don't know if there's like any other comments or questions. Yeah, I'm seeing here basically Jasmine sharing the exit survey and also the link to register for next week. It'll be a very, very interesting session. Yeah, so thank you for being here today. It was a very interesting day, a lot of participation, a lot of different partners and people from the academia, public sector, consulting. So it's really nice to see like a diversity of people participating in this session today. I don't know if you have any other last comments, Jasmine, Steve?
No, thank you everyone for attending. We shared a link for our second day, as Nacho mentioned, and then a quick exit survey as well. So if there's no last comments, thank you again. Thanks to all our students. Thanks, Steve, if you want to say anything.
No, just thanks to everybody. We have 35 students in our project so far, and it was great to hear from these 5, and just yeah, looking forward to next week when I think more great research will be presented, some products are going to be released, and some really great discussions will be had. So look forward to seeing you then.
Thank you, everyone.
Thank you.
Thanks.